Welcome to Pop Health Week, streaming live on Healthcare Now Radio. I'm Greg Masters, co-host and executive producer, and in the virtual studio is my partner and co-founder, Fred Goldstein, lead host and president at Accountable Health, LLC. Pop Health Week is where the movers and shakers of population health gather. We're all about those real, unfiltered conversations with the people shaping the industry, whether you're a payer, provider, patient, vendor, or part of the regulatory crew. This is your hub for the freshest strategies and innovations in population health management. Want to stay connected? Head over to popupstudio.productions or shoot me a message on Twitter via @GregMastersMPH. And yes, that's Greg with 2 G's. You can also reach out to Fred direct on Twitter via @FSGoldstein or visit www.accountablehealthllc.com. Today, we are joined by Thomas Silvera, a certified surgical technologist with a Master of Health Sciences in Public Health and a Doctor of Health Sciences candidate. Thomas is the co-founder and vice president of the Elijah-Alavi Foundation, Inc., dedicated to food allergy and asthma awareness education and, might I add, harm reduction. After tragically losing his 3-year-old son, Elijah, in 2017 due to a lack of awareness around food allergies, Thomas transformed his grief into a mission to prevent such devastating loss in the future, a subject very close to my heart. Fred, help us get to know Thomas and Elijah's tragic story. The mic is yours.
Thanks so much, Greg. And Tom, welcome to Pop Health Week.
Thank you for having me, Fred. It's a pleasure being here.
Yeah, it's really a pleasure to get you on. We met a couple of months ago, I guess, at the Food Allergies Conference up at Northwestern, discussing the importance of this issue, which I had more recently learned about. And we shared a panel together, I think a couple panels, actually. So why don't we start? Give us a little bit of your background and tell us your story.
Yeah, so a little bit of my background. Those who don't know, my name is Thomas Silvera. I am currently residing in Pennsylvania. I used to live in New York City. I am in school getting my doctorates in health sciences with a focus in public policy and public health. And the premise of all that was we go back to November 3rd of 2017. My youngest son, Elijah-Alavi, who was only 3, started his first week of childcare. And within his 4th day of school, had changed the life of myself and my family. So on that day, my son suffers with multiple food allergies, and one of them is dairy. At his childcare center, prior to all that, we made sure that we did our research within the schools within our location when we lived in New York City at the time in Harlem. And we found a school that definitely could accommodate, Elijah's needs, that he was also, he had multiple food allergies and asthma. We went to the school. We made sure that they assured us that they did understand how to administer epinephrine, understand the signs and symptoms, and act in the event of emergency. We crossed out T's, dotted out I's with all the paperwork, provided the medications, nebulized, and so forth to the school. But on that Friday, November 3rd, 2017, my son had succumbed to his demise. He was given a grilled cheese sandwich by an educator there. They fed him outside of his specialized meal plan that he was supposed to get. And instead of calling 911 when they realized he was suffering with respiratory distress, it was already too far along. If we understand how anaphylaxis works, the respiratory system was affecting him. And then him being asthmatic, the school didn't really do their homework in understanding what signs and symptoms was after they had relayed that information that they did understand. So instead of calling 911, they called his mom. His mom noticed that he was in distress, rushed him to the hospital, which he, even after 8 rounds of epinephrine, they couldn't save him. And from that point on, it's like we enter a space where no parent ever wants to be in, and which is the loss of a child. So in our grief, we knew that something more had to be done. So my wife at the time, she did her research and noticed we looked into childcare policies, regulations within New York City, New York State, and noticed that there was nothing actually guiding or putting any policies in for protection for childcare centers in New York. And it was kind of baffling because if you have policies for K through 12, why do we miss the most vulnerable children? which is like it's like I said, it's baffling and it's mind blowing. So what we did, we decided to work with our local officials within New York, within the areas that we lived in, and we also reached out to an organization called FAIR at the time. And we wrote up components of the bill to kind of like put some policies in place, for protection, and it looked good for the first few months around, but the legislation was kind of like, it didn't move in the direction that we wanted to. So it didn't move in the Senate. It moved in the Senate, but not in the Assembly. So we decided to actually just kind of like remove working with with FAIR, and not knocking FAIR. FAIR is a great organization, but we decided to do this on our own. So we went back to our local officials. We rewrote that whole section for childcare centers for New York State. And then we noticed once we submitted the legislation, it just had been moving seamless, like through the process with no opposition, except for one part, which was in a financial implication, which they were like, who's going to pay for the epinephrine? Once we removed that component of the bill, it started moving unanimously through the process and then passing and signed by the governor, Cuomo, at the time on September 12, 2019, which became the very first bill in New York State and the first in the nation to actually have a mandatory bill such as this to protect children in a child care center. And that just opened up the world for both my ex-wife and I, and co-founder of the Elijah-Alavi Foundation, to not just stay at New York. We decided we need to do this state by state. So we worked with another organization called APHA, this Asthma and Allergy Foundation of America. We worked on putting a toolkit together, which we did a very robust research in every single state and show their policies and guidance and how they protect children. And we noticed that there are a lot of states that don't protect children, especially the most vulnerable. So what we do with Elijah's Law, we go into those states, see what's missing, and we close the gap. And we make sure we protect all children within those states.
And you've now gotten those laws passed in other states, right?
Oh, yeah, absolutely. So we got the law passed, New York being the very first. Illinois is the second. Virginia, we just recently passed a bill in Maryland, got it signed by the governor as well. We have a city ordinance in Kansas City. We have a component of Elijah's Law in Connecticut within an epinephrine bill. We currently have a bill moving through the Appropriation Committee in California, which is right now in the suspense part of the legislation, and we're looking for it to move into the floor to get voted out and passed. We have a bill currently right now in Pennsylvania, and we're looking within other states to bring Elijah's Law there.
That's fantastic. And you also, through the foundation, you do teaching and training as well?
Yeah, so, we're not just advocacy. We also focus on research. We actually presented our first research at the CFAR event, which is on the patient perspective. We want to start focusing more on research on the patient's perspective, opposed to dealing with the medical model or the biologics of what medications will help with food allergies. But we want to get that more in-depth understanding on how patients are affected by, everything on the landscape when it comes to food allergies and asthma as well. We do food allergy training. We have an in-depth, robust curriculum that we just designed, and we're launching it within our first pilot school this year. And we're hoping to gain more traction with that within the next year and grow from there. We do community outreach. We have a couple of outreach programs that we're doing this summer. And again, we go into school, we do public speaking. So we don't just stop there. It's not just about advocacy or legislation. It's about awareness. It's about community, and it's about, we need to have the community that don't know about food allergies and asthma know about it, so we can provide the right care, the right questions can be asked, and the help can be provided to so many.
So Thomas, let's talk about that a little bit. Can you sort of give our audience a sense of the food allergy issue in the United States and how big it is? I mean, most people, as you said, have no idea, and it's growing, right?
Yeah. So when we looked at the statistical analysis, and I'm a big proponent for statistics, that's what drives, the public health system. That's what drives the awareness of what's going on. We look at the prevalence of asthma. We know that's on the rise. We've known that for years. Same thing with type 2 diabetes. We know that. But when it comes to food allergies, it's one of those missing pieces within the compounds of not just in the US, but also across the globe, that is being looked at as not something that is that serious to be noticed. So it takes a lot more depth. other than the emergency room visits and the amount of medications being driven. So we look at the statistics for asthma, for diabetes, and everything. We compare them to those with food allergies. The numbers for food allergies are not that alarming to kind of like have the CDC, the FDA, the WHO, and everybody to be up on the uprise. But it is a growing epidemic. I call it a pandemic because, and then when we look at the number, I think 53 million, 5.6 million kids, don't quote me on that. But those numbers are just numbers that we get for data to present. But if we go into the inner city, the underserved communities, that these numbers are not being reflected. So what are the numbers? If we look at that, what are the prevalence of food allergies? What are the prevalence of asthma and so forth and so forth? It grows. So the numbers are alarming for that, just in a minuscule, but it's not enough that more funding can go in to fight this, because there is no cure for food allergies. So we have to keep putting money into research to find like medications like, the patch or Xolair and so forth to help mitigate, these issues with so many that suffer with food allergies or any non-allergy specifics in terms of how to help them. So until we do something about that, the numbers are going to be the numbers, but I believe the numbers are a little bit higher than what we're reflecting out into the community.
Absolutely. And I think you raised an interesting point. You sort of start delving into it. And that's when you begin to look at disadvantaged populations, or as you talked about, inner city, et cetera. And what really stunned me as I began to get more involved and hear more about this was how impactful it is on the life of the individual with the food allergy, as well as their families. And can you talk about that some?
Well, and the thing about that, especially in the underserved communities, whether you're Black, Hispanic, white, Jewish, Indian, everyone has an underserved community. It's not just focused on the Black or Hispanic population, but we know the prevalence of that are more higher in African Americans and somewhat in Hispanic, but everybody falls within the underserved. So the effect of that is like we talk about the socio-economical factors that fall into place with that. We talk about the financial aspect, we talk about the cultural aspects, we talk about the educational and so forth. The mental health aspects that falls into place with that as well. How do you afford medication? What type of food allergy management can be provided to us via our healthcare providers? What is the distance between from an actual specialist that we can afford, to get allergy care? Because sometimes even sitting in the meetings, it's like I'm listening to pediatricians and how they handle food allergies. And, it's mostly you have to hand them off to a specialist, because their actual pediatrician cannot do more than what they can do based on their scope of practice. So you have to go to a specialist, and that's an out-of-pocket expense. People in underserved community can afford that. Even with the cap prices on epinephrine and with the asthma inhaler, a $50 cap or $30 cap, some people in the underserved community cannot afford that. And if they could, they only get one. And if they have multiple kids with asthma or food allergies, that one medication will be the life-saving device for all, because they can't afford more of that. And we look at that even when it comes to food, the access to safe foods for them. If you live in an underserved community, a lot of the supermarkets or grocery stores, or they call the bodegas, don't have the adequate amount of food that can actually provide safe foods for them. There's no gluten-free food, there's no allergy-friendly food. So you have to kind of like go outside of your community and go spend more money for that. So those are the financial aspects. So in the environmental aspects of that, if you live in the underserved community, you have a higher pollution rate, you have a higher rodent rate, you have all that plays a factor into that. There's research that says the possibility of rodents being affected with, affecting you with food allergies, also with asthma. We know mice and roaches are one of the big proponents for asthmatics. Me living in the underserved community growing up, I'm an asthmatic. I lived in those harsh neighborhoods, in those bad communities, in the bad housing, and being affected with asthma every single day, being in and out of hospital because of that. So it just affects in a full circle. And then all that affects your mental health. So now who's going to come in and provide those needed access of care for food allergy management? And that's one of the big things. It's like you get the proper food allergy management within these communities and guide them. And that's when we talk about getting community health workers into play, will play a big proponent of that. But they don't do that. They used to do that a long time ago. But again, it comes down to funding. If there's not enough funding to provide that type of resource to the underserved community, we're not going to be able to give the access to them. That's why with my organization, we try to raise enough funding to go into communities, but funding for us is so scarce. It's like we can only do but so much what we have. Either we try to do a lot via social media, or if we do a community event, we make sure we go into the underserved population. We have a couple that's coming up within the summer, and it helps, but we want to do more. And it takes like organizations like ours and others, they really have to. I always say this: don't just talk about it, be about it.
Just tuning in, we're here with Thomas Silvera, certified surgical technologist with a Master of Science in Health Services and Public Health and a Doctor of Health Sciences candidate. Thomas is the co-founder and vice president of the Elijah-Alavi Foundation, Inc., pushing the envelope on food allergy and asthma awareness and education. Stick around, you won't want to miss the rest of the story.
Yeah, and as you point out, it's not just the funding, it's the access. If there's no specialist there, if there's no allergy immunologist there, and then living where you have to say, oh, I'm going to somebody's house, or there's an event somewhere I've got to go to, and the stress that might induce on individuals because of having a food allergy, it's just amazing to think about. And, I know both my boys had asthma, fairly severe as younger kids, and we were lucky. We were able to access an allergist immunology clinic, but I watched as our friends who had children of similar ages had children with asthma as well, and they were not going to a specialist. And finally, after a couple of years, my wife talked to him, as she's a nurse, and said, you really need to switch. If you go to the doctor, what you're getting for results right now are not as good as you could get. And so they did. And you could see the power of that. But not having access to that kind of care, to those kinds of services, really makes this a difficult one. And I know at the conference, they talked about the general lack of the number of allergists within the United States, given the population and the needs for these services.
Yeah, that number was alarming. And it's like, I think it's based up to the person to want to go into that specialized field. It's not like we can, push, it's not a thing that's given in med school. It's like, hey, this is what you should do. It's not a focus. It's like whatever the person's passion is, they go into those schools and that's what they thrive to do, or they change their course of profession. If they're currently in the profession and want to focus in a different field, that's what they do. Other than that, the numbers for specialists across the United States I couldn't believe that number was so low.
Mm-hmm. And so as you go around, are you going around to the country and then working with different organizations that are then working with their local legislative officials and elected officials to try and get these laws into place?
So with me, I kind of will sit at my computer and my cell phone and call every state and send emails to legislators. And I work with the organizations as well. And I work with advocates, who live in these states. And we also, with the toolkit, we promote that via social media. And it's like, hey, if you want Elijah law in your hometown or your state, please reach out to us. We're more than happy to work with you and your legislative official to get Elijah's law in your state. So that's what we do. We make sure we work with everyone. And, and the thing about it, I'm there for every piece of legislation. I sit with the legislators in these meetings. I work with, whoever it is, they sit in these meetings with me to make sure we can get these legislators to understand the importance of this law. Elijah's law, yes, is named after my son, his namesake, but it's more than just a law with his name. It's a law that provides protection for children and in childcare centers to give educators the proper tools to care and to act of emergency and give parents peace of mind. And that's what we want. We want to make sure of that because New York is doing a phenomenal job of doing that. Because if there's an incident in a childcare center in New York is right on top of it. They make sure that they go in, they do audits into the school. They make sure that the school did their due diligence. And if they didn't, there's a possibility the school gets shut down. So that's really serious. And I like what they're doing. Schools, childcare centers don't like that. But you don't want another child's life on your hand. And I love that New York is actually doing the job. And we want that to be emulated across the board. Not just New York. We want other states to adopt that same policy. And it's hard because every state's childcare center is run by different entities. And they don't really, a lot of states don't like mandated policies. So we work within the, Department of Children and Family Services, Department of Health, Department of Education, to kind of give them a better understanding of why we're doing this. you know,
Mhm.
because some states will just like won't pass the bill because they think it's, it's scary, but a child's death is even scarier.
Absolutely. And, I think, as you said, it's Elijah's law, but the impact, even now, you've got those states that are doing it in cities, is on tens of thousands of children, hopefully protecting them and their families from these kinds of tragedies. If somebody wants to get involved and help, what would you tell them to do, and where would you point them?
Oh, if someone is interested in getting involved and helping and bringing Elijah's Law or want to do a speaking, want me to go teach at their school or whatever, it's just go to our website, go to the Elijah-Alavi Foundation.org. Go reach out to us on our Instagram at Elijah's Echo, or I think those are pretty much the spaces they can go. And we are there every step of the way. We try to answer every email accordingly as fast as possible, but definitely go to www.Elijah-Alavi Foundation.org, and they'll definitely, you send us a message and we're more than happy to respond promptly.
That's fantastic. It really is. And I really appreciate all the work you've done around this, obviously, to help a lot of families and hopefully many more in the future.
Yep.
Do you have any sense of where some of these other states are? Are they getting close with a few of them?
California right now, we're in the process of, because their session is coming to an end. So right now it's in the suspense calendar, meaning they're looking over it and making sure that, everything is kind of like put into place. There won't be any financial implications or whatever before they move it through onto the floor. And once it moves to the floor, I think next week is when they're having that vote on that. And then if it gets voted out of the Senate, then it goes to the governor. So, we're very optimistic about it. It didn't pass, I believe, in 2021, but it wasn't it was the entities didn't agree on a policy. That's why the governor vetoed the bill. It was a great piece of legislation, is that we wanted these entities to agree upon a specific policy. Pennsylvania, we have the bill currently right now in process. It's just moving that. Pennsylvania's sessions are kind of interesting. It's almost like all year long. It's like how their sessions work and everything. So we've been working with them and we're looking for it to be fully submitted. It's, again, it comes down to who's going to fund this. But there is a grant that's out there, which is the Child Care Federal Block Grant, that actually helps specifically with when it comes to child care center. And one of the components is to provide food allergy training and epinephrine access within that grant. So it makes it easier for states to get access to that. And that's what New York did. New York took advantage of $20 million from that grant for Elijah's Law. So these states can understand, like, hey, you can get access to that.
Mm-hmm.
So, it's in the process, and we're very hopeful for the outcome of these bills.
That's great. And you said you're working on your doctorate in healthcare policy?
Yeah, so I'm doing my doctorate in health sciences with a focus on public health and public policy because originally I was actually going to school to become a physician assistant, but what happened to my son, it just changed the trajectory of my life. And I got my degree as a certified surgical technologist. Originally, I wanted to be a surgical physician assistant, but then I went and got my bachelor's in health science and health education, and then went straight from my bachelor's into my master's in public health, and then straight from my master's into my doctorates in health sciences. So I've been in school nonstop, and I'm in the process of presenting my proposal research now, and hopefully I should be done by the end of this year with everything.
That's fantastic. And you balance that with the foundation.
Correct. Yeah. It's all about time management. And I also, just to give you a little premise, I suffered a severe concussion back in 2022. So it put a lot on me, but I learned how to manage my time, manage my stress, even just still dealing with the grief, as Greg and I had mentioned. It's like, still dealing with that. It's hard, but what drives me is my children, the passion from both my son, Sebastian, who also has multiple food allergies, and my son, Elijah. And I was like, and I wouldn't be where I'm at without that drive that kind of like allows me to put that one foot forward every day when I wake up.
And what are your plans once you've achieved your doctorate?
I have no idea. I've been in school for so long, and the reason for this, and then I tell you the path. The reason why I walked this path, because I feel like my son's life was his life was taken from him so soon, and I'm walking a path for him as well, that these are the things that he could have accomplished. So I wanted to walk that path for him as well, and walk a path for my son and show him what it is when you're passionate about something. So, and that's it. And I want to grow the organization on a bigger platform, focus more on research and everything. And the doctor's degree it's not for the accolades to say that's Dr. Thomas Silvera. It's just I wanted to run this path for my sons, and I wanted to just accomplish all that, because I believe there's so much more that needs to be done. And if I could be just a little pebble in that ripple effect, to help so many, let it be.
Yeah. Fantastic. I think you've proven to be more than just a pebble.
I appreciate that.
With what you've accomplished so far is really unbelievable.
Thank you.
I know, and Greg knows how hard it is to get legislation through, and particularly associated with healthcare. And as you talked about, it's associated with money, and people are always worried about who's funding this or that. But this is really something for the right reason, for the right stuff to help people. And I think it's fantastic how far you've taken this and how far it's going to go, because I think you're going to roll those states and get the laws out there and into the community to help a lot of people. So I really want to thank you for coming on, Thomas. It's been just fantastic. And if there's anything we can do to help, please let us know.
Yeah, no, I appreciate you having me and, allow me to share my story. I think, a story has to be shared not just one time, because in the state of, the world, when a story is shared once, it gets kind of like died out with the background of everything that's been happening, not just of today, but in the future. So the more a story is shared, the more awareness comes about from it. And, and I appreciate this, allow me to talk on this platform.
Well, it's really our pleasure. And back to you, Greg.
And that's a wrap for today's episode, folks. A big shout out to our global audience for tuning in, and a special thank you to Thomas Silvera, certified surgical technologist and Doctor of Health Sciences candidate. His work with the Elijah-Alavi Foundation is nothing short of inspiring, championing food allergy and asthma awareness and education. To follow Thomas's vital work, visit www.Elijah-Alavi-Foundation.org and connect with him on Twitter or Instagram via @ElijahsEcho. If PopHealth Week resonates with you, we'd love your support. Give us a thumbs up on your favorite podcast platform, share it with your network, and don't forget to subscribe to never miss an episode. Remember, we're live on Healthcare Now Radio weekdays at 5:30 a.m., 1:30 p.m., and 9:30 p.m. Eastern. And West Coast listeners, that's 2:30 a.m., 10:30 a.m., and 6:30 p.m. Pacific. On behalf of Fred Goldstein and myself, Greg Masters, stay safe, stay tuned, and we'll catch you next time.